Good day everyone, I'm Ruth Abigail C. Lagura, Bachelor of Science in Criminology student, first year, section Alpha. In this video, I'm going to talk about natural and artificial methods of contraception. So without further ado, let's move to the discussion.
So as I said, I'm going to discuss about natural and artificial methods of contraception. So first, let's talk about natural methods of contraception. There are different methods of it. First, abstinence, calendar method, basal body temperature, cervical mucus method, symptothermal method, ovulation detection, and coitus interruptus. Before we proceed to those methods, let's understand first what is natural method of contraception. So natural birth control is a method of preventing pregnancy without the use of medications or physical devices. These concepts are based on awareness and observations about a woman's body and menstrual cycle. So it only means that people don't use any devices in knowing a woman's body or menstrual cycle. People only use natural methods in controlling the pregnancy, and this is where those methods are in. The first method is the abstinence. Abstinence from a sexual activity means not having any sexual intercourse at all. No sexual intercourse with a member of the opposite sex means that there is no chance that a man's sperm can fertilize a woman's egg. In this method, if we keep a track of the time of ovulation, we can avoid pregnancy. This method is 100% effective, and it is most successful when you are diligent and use planning within your relationships. The advantages of abstinence includes it has no side effects or health risks, prevents pregnancy and the transmission of sexually transmitted diseases, it is free, it reduces emotional and psychological challenges related to relationships that involve sexual activity, and its disadvantages, it requires willpower and discipline. Calendar method. The calendar rhythm method to avoid pregnancy relies upon calculating a woman's fertile period on the calendar. Based upon her 12 previous menstrual cycles, a woman subtracts 18 days from her shortest menstrual cycle to determine her first fertile day, and 11 days from her longest menstrual cycle to determine her last fertile day. She can then calculate the total number of days during which she may ovulate. If a woman's menstrual cycles are quite irregular from month to month, there will be a greater number of days during which she might become pregnant. This method allows women to do workout when they are potentially fertile and when they are definitely infertile. But this method is only about 80% effective in preventing pregnancy, and when used alone, it is considered outdated and ineffective. So if this method won't be followed properly, then there's a doubt that a woman won't be pregnant. Basal body temperature. This method is based upon the fact that a woman's temperature drops 12 to 24 hours before an egg is released from her ovary and then increases again once the egg has been released. The basal body temperature method requires that a woman take her temperature every morning before she gets out of bed. A special thermometer that is more than accurate and sensitive than a typical oral thermometer must be used, and the daily temperature variations carefully noted. This must be done every month. Online calculators are available to help a woman chart her basal body temperature. To use the basal body temperature as a birth control method, a woman should refrain from having sexual intercourse from the time her temperature drops until at least 48 to 72 hours after her temperature increases again. Everybody must use this method properly and carefully in order to avoid unnecessary results. The advantages of basal body temperature are the following. It is 100% natural, it is easy, no side effects, effective, eco-friendly, save money, family planning, get to know your body, natural intercourse, and stop whenever. And its disadvantages are the following: it doesn't protect from STDs, takes good partnership, not for every woman, self-discipline, fertile days, and adjustment time. Cervical mucus method. In this method, you track the color, thickness, and texture of your cervical mucus to monitor your fertility. Your cervical mucus becomes thinner, slippery, and stretchy when you ovulate. Tracking your cervical mucus will require some practice. The cervical mucus method is good for determining when you're fertile by using your vaginal discharge as a way to determine where you are in your cycle. One disadvantage is that this method is not always easy to learn without the guidance of your OB/GYN or doctor. Symptothermal method is a combination of the calendar, cervical mucus, and basal temperature methods. The symptothermal method, in which you use all three of the methods above together, makes fertility awareness method most effective. You should track at least 6 to 12 menstrual cycles before you begin to rely on fertility awareness method for contraception. But it can also be great and effective choice for those who are willing to invest the time and understanding. The symptothermal method has a significant advantage in effectiveness because it combines the calendar, cervical mucus, and basal temperature methods. However, this technique shares the same disadvantages that each of these techniques has individually. Ovulation indicator testing kits. A woman can use an ovulation prediction kit to determine when she is most likely to ovulate. This special kit measures the amount of luteinizing hormone in the urine. Because luteinizing hormone promotes the maturation of an egg in the ovary, the amount of luteinizing hormone usually increases 20 to 48 hours before ovulation. This increase is called the luteinizing hormone surge, which can then be detected in a woman's urine 8 to 12 hours later. The ovulation prediction kit is designed to measure the amount of luteinizing hormone in the urine. Ovulation prediction kits are used primarily to increase the chance of a woman becoming pregnant, but they can also indicate to the woman that she is about to ovulate and should take appropriate contraceptive precautions. The advantage of ovulation test kits is that it may be beneficial if you have slightly irregular periods or find other methods of tracking your fertility difficult or unreliable. The disadvantage of it is that ovulation test kits can be expensive and there are no guarantees. Coitus interruptus, or also known as withdrawal. Coitus means sexual intercourse, while interruptus means interrupt or to stop. Using the withdrawal methods, the man withdraws his penis from a woman's vagina before he ejaculates so that the sperm released from his penis does not enter her vagina. It means that if they are having sexual intercourse and if the boy withdraws his penis before he can release sperm inside the girl, then they can avoid pregnancy. But the boy needs to withdraw his penis right before ejaculation so that the sperm can never meet the ovum. The advantages of using withdrawal is that pulling out makes other forms of birth control even more effective. No matter what birth control you use, pulling out helps your method pack an even bigger pregnancy preventing punch. There are problems with using withdrawal as a contraceptive method. First, a man may release small amounts of sperm before actual ejaculation. Secondly, a man needs self-control and a precise sense of timing to be able to withdraw his penis from the woman's vagina before he ejaculates. Because this can be difficult for the man to complete successfully, the withdrawal method is only about 75% to 80% effective in preventing pregnancy. There are also measurements and limitations in doing this method in order to prevent pregnancy. So those are the natural method of contraception. And now I will discuss the advantages and disadvantages of natural method of contraception. The advantages of it includes cost saving, lack of prescriptions or healthcare visits, and avoidance of medications or procedures. While its disadvantages are the fact that they can be difficult to use correctly and the sexual intercourse must be avoided at certain times of the month. So that's all about natural method of contraception. So let's move forward in discussing the artificial method of contraception. Artificial method of contraception is the process used to prevent pregnancy and plan for the birth of children at the most optimum time, commonly referred to as birth control. Family planning can be accomplished using a variety of methods. Artificial method of contraceptives includes oral contraceptives, transdermal patch, vaginal ring, subdermal implants, hormonal injections, intrauterine device, chemical barriers, diaphragm, cervical cap, male condoms, female condoms, and surgical methods. Among those artificial methods, first let us discuss the oral contraceptives. Oral contraceptive pill is the little tablet taken once a day. The oral contraceptive pill is the most commonly reported method of contraception used by Australian women. There are a few different types of pill to choose from, so it's about finding the one that's right for you. The combined pill contains estrogen and progestin, and mini pill contains only one hormone, a progestin. The pill can have many benefits. However, remembering to take it on time is a must. The advantages of taking the pill includes highly effective when used correctly, permits sexual spontaneity, and doesn't interrupt sex. Some pills may even reduce heavy and painful periods and or may have a positive effect on acne. The disadvantages of it is that forgetting to take your pill means it won't be as effective. It can only be used by women. It's not suitable for women who can take estrogen-containing contraception. It does not protect against STIs. Transdermal patch is a medicated adhesive patch that is placed on the skin to deliver a specific dose of medication through the skin and into the bloodstream. An advantage of a transdermal drug delivery route over other types of medication delivery, such as oral, topical, intravenous, or intramuscular, is that the patch provides a controlled release of the medication into the patient, usually through either a porous membrane covering a reservoir of medication or through body heat melting thin layers of medication embedded in the adhesive. The main disadvantage to transdermal delivery systems stems from the fact that the skin is a very effective barrier. As a result, only medications whose molecules are small enough to penetrate the skin can be delivered by this method. Vaginal ring or NuvaRing. The vaginal ring is a small, flexible ring that contains the same hormones as the pill and patch, estrogen and progestin. The hormones in the vaginal ring keep the eggs from leaving the ovaries and thicken the cervical mucus, which prevents pregnancies. It is worn inside the vagina to prevent pregnancies. Common side effects of vaginal ring includes the following: bleeding between periods, breast tenderness, nausea and vomiting, change in sexual desire, and irritation of the vagina. The advantages of it are it may reduce menstrual cramping, may lead to lighter periods, and cost may be covered by your health insurance, while its disadvantages are it doesn't have STD protection and may cost up to $80 per month if not covered by your health insurance. Subdermal implants. The same hormone in the birth control shot can be delivered in an implant. Implanon and Explanon are brands of birth control implants. The hormone in the implant progestin works with the body to prevent the eggs from leaving the ovaries. Since the eggs stay in the ovaries, the sperm is unable to join the egg. The implant is a small, matchstick-sized device implanted beneath the skin of the upper arm. A doctor will mount a small area of your arm and insert the implant. After 4 years or any time before this that you wish, the implant will be removed by a doctor. The advantages of it is that it is long-lasting, very effective, can be used while breastfeeding, and cost may be covered by your health insurance. And its disadvantages are it doesn't have a steady protection, may cost up to $800 if not covered by your health insurance. Hormonal injections. It is used to prevent pregnancy by injecting a synthetic version of the hormone progestogen called dipeptidyl-medroxyprogesterone acetate or DMPA. The injection is also called depo. Depo prevents the body from producing its own hormones and releasing eggs from the ovaries. Its advantages are: one injection lasts 12 weeks. It doesn't interfere with sexual intercourse, usually no periods, and useful for women who can take combined pill. While its disadvantages are: it causes irregular bleeding, no periods or occasional heavy bleeding. Periods and fertility take an average of 6 months to return after stopping the injection and may have change in weight. Intrauterine device. The IUD or intrauterine device is a small T-shaped device inserted by a doctor into the uterus. It prevents pregnancy for a number of years. Paragard is the name for an IUD that contains copper and can be in place for up to 10 years. The advantages of IUDs are it is long-lasting, may reduce period cramps, cost may be covered by your health insurance, and may reduce menstrual flow. While its disadvantages are it doesn't protect you from STD, requires doctor visit and costs up to $1,000, lasts up to 10 years depending on the type, mild to moderate pain when IUD is inserted, spotting between periods from the first 3 to 6 months. Chemical barriers or spermicides are sperm-killing substances available as foams, creams, gels, films, or suppositories, which are often used in female contraception in conjunction with mechanical barriers and other devices. Spermicides are usually available without a prescription or medical examination. Its advantages are it is easily to apply, available over the counter, and it is inexpensive. While its disadvantages are it doesn't prevent pregnancy as well as IUDs or hormonal forms of birth control. Diaphragm. Although not as popular as other birth control methods, the diaphragm is another way to prevent conception. The diaphragm is a rubber dome that is inserted into the vagina and placed over the cervix before sexual activity. When the diaphragm is in place, the opening to the uterus is blocked and the sperm is unable to join with an egg. The advantages of it is that it can be put in several hours before sexual intercourse, used only when needed, and helps protect against STIs. While its disadvantages are: first fitting should be by an experienced nurse or doctor. Some women find it hard to put in and take out. Spermicide may irritate vagina or penis and must be left in place at least 6 hours after sexual intercourse. Cervical cap. A cervical cap is another barrier method of contraception. It is smaller than a diaphragm and fits over the cervix. Like the diaphragm, a cervical cap is used with spermicide. The cervical cap blocks the opening to the uterus and prevents sperm from joining with an egg. FemCap is the only brand of cervical cap available in the United States. Cervical cap's advantages are it can remain in place up to 48 hours, cannot be felt by you or your partner, and can be used during breastfeeding. while its disadvantages are it doesn't have a steady protection, requires a doctor visit for fitting, cannot use during menstruation, may be difficult to insert, must be placed prior to sex every time, and spermicide may have side effects. Male condoms. Male condom is a barrier method involved in preventing contact between sperm and egg. Latex male condoms are the classic methods of barrier contraception, but they can be made of natural animal membrane, polyurethane, silicone, or other synthetic material. During ejaculation, a condom is designed to catch semen, stopping it from entering the vagina. The advantages of it is that it can prevent STD, extremely easy to purchase, inexpensive, some are even free. It is very easy to use. Male condoms can provide increased sensation for both partners. Try experimenting with different styles, shapes, flavors, and textures of male condoms. It can be used for oral, anal, and vaginal sex, and can be used with other birth control methods. While its disadvantages are it is only one-time use, required every time you have sex, must be used properly in order for effectiveness, not as effective as other birth control methods. Female condoms. This birth control option is a plastic, pouch-like device inserted in the vagina before sex that offers clitoral stimulation. The female condom can also be inserted into the anus prior to anal sex. The female condom has flexible rings at each end that can stimulate the clitoris during the vaginal sex. Its advantages is that it can prevent STD, it is safe, simple, and convenient, extremely easy to purchase, inexpensive, offers clitoral stimulation, and allows additional foreplay. While its disadvantages are it not as effective as other birth control methods, may cause irritation of the vagina, vulva, penis or anus, reduced sensation during intercourse, crackling or popping noise may occur during intercourse. Surgical method. Surgical method procedures for family planning include tubal ligation for female sterilization and vasectomy for male sterilization. It is very effective at preventing pregnancy and it is considered a permanent method of contraception. Its disadvantages is that it requires surgery, usually under a general anesthetic. There is a risk, albeit low, of surgical complications such as internal bleeding, infection, or damage to other organs. So let's wrap this up. Those are the artificial and natural methods of contraception.